Hello and welcome back to Public Health Talk with Nurse Oyeyemi. Today we are going to talk about something very important, something many people are living with without even realizing it, and that is high blood pressure, also known as hypertension. High blood pressure is often called a silent condition because many people do not experience obvious symptoms. They feel fine, they go to work, they take care of their families, and everything seems normal. But inside the body, damage may already be happening slowly over time. That is why it is very important to understand the warning signs your body may give you, even if they seem small or easy to ignore. Let us start with something very common, and that is frequent headaches. If you notice that you often have headaches, especially early in the morning or at the back of your head, it may not just be stress or lack of sleep. It could be a sign that your blood pressure is higher than normal. Now let us talk about dizziness. Do you sometimes feel lightheaded, unsteady, or like the room is spinning, especially when you stand up quickly or move suddenly? This could be related to your blood pressure and how your body is adjusting to changes. Another important sign is blurred vision. High blood pressure can affect the tiny blood vessels in your eyes. You may start to notice that your vision becomes unclear or you struggle to focus the way you used to. Some people ignore this and assume it is just eye strain, but it could be something more serious. Let us also talk about chest discomfort. It may not always feel like sharp pain. Sometimes it is a feeling of pressure, tightness, or heaviness in the chest. This is your body telling you that your heart may be under stress, and this should never be ignored. Now think about shortness of breath. If you find it difficult to breathe properly during simple activities like walking, climbing stairs, or doing light housework, it could be related to your heart and blood pressure. Fatigue is another important sign. Many people feel tired and blame it on work, stress, or poor sleep. But if you are constantly tired, even after resting, it could be a sign that your body is not functioning efficiently, possibly due to high blood pressure. Let us go deeper. Some people may also experience a pounding feeling in their chest, neck, or ears. Others may feel anxious or uncomfortable without knowing why. But here's the most important part. Some people will experience none of these symptoms at all. You may feel completely fine, yet your blood pressure is dangerously high. This is why hypertension is called a silent killer. That is why regular monitoring is very important. Do not wait until your body starts giving serious warning signs before you take action. Now let us talk about who is at risk. People who eat a lot of salty or processed foods are at higher risk. People who are physically inactive, meaning they do not exercise regularly, are also at risk. Being overweight or obese increases your chances of developing high blood pressure. Chronic stress is another major factor. When your body is constantly under stress, it affects your blood pressure over time. Family history also plays a role. If high blood pressure runs in your family, you need to be more intentional about checking and managing your health. Also, excessive alcohol intake and smoking can increase your risk. Now let us make this practical. Even if you feel healthy, it is important to check your blood pressure regularly. You can do this at a hospital, pharmacy, or even at home with a digital monitor. Knowing your numbers is the first step to protecting your health. In the next part, we will talk about what can happen if high blood pressure is not controlled and the simple steps you can take to prevent serious complications. Welcome back to Public Health Talk with Nurse Oyeyemi. In this part, we are going to go deeper into why high blood pressure is dangerous and what you can do to protect yourself and stay healthy. As we mentioned earlier, high blood pressure is often silent. You may feel fine, go about your daily activities, and assume everything is normal. But even when it is silent, it is not harmless. Over time, it can slowly damage important organs in your body without you even realizing it. Let us start with the heart. Your heart works continuously to pump blood around your body. When your blood pressure is high, your heart has to work harder than normal to push blood through your blood vessels. Over time, this extra effort can cause the heart muscle to become thickened and less efficient. This can eventually lead to heart enlargement, heart failure, or even a heart attack. Now let us talk about the brain. High blood pressure is one of the leading causes of stroke. A stroke can happen suddenly and without warning. It can affect your ability to speak, move, or even think clearly. Some people recover, but others may live with long-term disability. This is why controlling your blood pressure is very important. Let us also consider the kidneys. Your kidneys help filter waste and maintain balance in your body. They rely on healthy blood vessels to function properly. High blood pressure can damage these blood vessels over time, reducing the kidney's ability to filter waste. This can lead to kidney disease or even kidney failure. Another important area is the eyes. High blood pressure can damage the delicate blood vessels in your eyes. You may not notice it immediately, but over time it can lead to vision problems and, in severe cases, loss of vision. Now let us talk about how this affects your everyday life. When your blood pressure is not controlled, you may start to feel less energetic, less focused, and generally unwell. You may not immediately connect it to blood pressure, but your body is gradually being affected. Now the good news is that there is a lot you can do to prevent and manage high blood pressure. Let us start with your diet. Reducing your salt intake is one of the most important steps. Many people consume more salt than they realize, especially through processed foods. Try to eat more fresh meals and reduce foods that are high in salt. Also, increase your intake of fruits and vegetables. These contain nutrients that help support healthy blood pressure. Now let us talk about physical activity. You do not need to go to the gym or do intense workouts. Simple activities like walking, dancing, or stretching regularly can help improve your circulation and reduce your blood pressure over time. Stress management is also very important. When you are constantly stressed, your body stays in a heightened state, which can affect your blood pressure. Try to find simple ways to relax. This could be through prayer, deep breathing, listening to calm music, or taking time for yourself. Sleep is another factor people often ignore. Poor sleep or lack of sleep can affect your blood pressure. Try to maintain a regular sleep pattern and ensure you are getting enough rest. Maintaining a healthy weight is also important. Excess weight puts additional strain on your heart and blood vessels. Even small weight loss can make a big difference in your blood pressure levels. Also, limit alcohol intake and avoid smoking. These habits can increase your blood pressure and damage your overall health. Now let us talk about monitoring. Checking your blood pressure regularly is very important. Do not assume everything is fine just because you feel okay. Many people discover they have high blood pressure only after complications have already started. You can check your blood pressure at a hospital, pharmacy, or at home using a digital monitor. Knowing your numbers helps you take control of your health early. Let us make this very clear. High blood pressure is preventable, and it is manageable if detected early, but it becomes dangerous when ignored. Take your health seriously, pay attention to your body, make small changes today that can protect your future. As a public health professional, my goal is to help you understand your health in a simple and practical way so you can make better decisions. If you found this video helpful, do not forget to like, share, and subscribe to Public Health Talk with Nurse Oyeyemi. Thank you for watching, and I will see you in the next video.